A simple walking test may help diagnose a cause of dementia. The test involves seeing how fast a person can walk while doing something else at the same time, such as counting backwards or carrying a tray. The study, published online by the medical journal Neurology, found that the walking test may help differentiate whether someone has idiopathic normal pressure hydrocephalus or progressive supranuclear palsy. Idiopathic normal pressure hydrocephalus, or INF, is caused by excess fluid in the brain, and can often be reversed. But doctors say it is usually not diagnosed because it shares symptoms such as walking, balance and thinking problems with other neurological conditions. Primarily progressive supranuclear palsy, PSP, which is caused by damage to nerve cells in the brain. There is no cure for PSP, but treatment may help ease symptoms. Study author Dr. Charlotte Selke, of the Ludwig Maximilian University of Munich in Germany, said, "It is important that people with idiopathic normal pressure hydrocephalus are accurately diagnosed so they can be treated, and their health can improve." A simple walking test may help determine if a person has INF or PSP relatively early in the course of the disease. Our study found that adding another task while someone walks, and evaluating how it affects their walking ability, improves accuracy of the diagnosis. The study involved 27 people with INF, 38 people with PSP, and 38 healthy people of similar sex and age. Those with PSP and healthy controls had an average age of 69. Those with INF had an average age of 72. All the participants received a complete neurologic exam, an eye exam, and an MRI scan as well as thinking and memory tests. All of them were able to walk at least 30 feet without a walker or cane. Researchers assessed participants' manner of walking, or gait, by having all participants walk on a pressure-sensitive carpet that was 22 feet long. People were first asked to walk at 3 different speeds: slow, their preferred speed, and as fast as possible. They were then asked to walk and count backwards at the same time, and after that, to walk while carrying a tray. The researchers found that walking while counting backwards resulted in a greater reduction of walking speed in those with PSP than in those with INF. Walking speed was reduced by 34% in those with PSP and by 17% in those with INF. Dr. Selke said that when walking while carrying a tray, gait worsened for those with PSP but actually improved for those with INF, which may mean the dual task test wasn't challenging enough for those with INF. She said, "People with PSP appear to be more sensitive to these dual task walking tests than people with INF." By just assessing walking, researchers were able to accurately diagnose who had PSP and who had INF 82% of the time. But when adding both dual task tests to the assessment, diagnostic accuracy increased to 97%. Dr. Selke added, "Our findings suggest that adding these dual task tests would be an inexpensive and effective way to improve diagnosis of INF." Future studies may want to increase the complexity of tasks to see if they provide even more accuracy as well as insight into how the two diseases affect gait.
Where the freak's at.